Hello, everybody. Welcome to another episode of Girl Talk with AC. So, for today's episode, the conversation gets quite intimate. We are talking about your sexual and reproductive health. And with me, I have an amazing guest, Chioma Uzoma. She's the Executive Director for Advocacy Initiative for Africa. She's a youth innovator and she's also an advocate for sexual and reproductive rights. So today's conversation is going to be very interesting and I'm sure everybody could gain some useful information from this. So just give me a few seconds while I invite our guest on.
Good
Hello.
evening.
Hello, good evening.
Yes, so nice to be here.
Nice to meet you. Welcome.
Me too, same here.
Yes.
My
Yeah, I
pleasure.
recently started following your page and you're doing such amazing work. So really well
Oh,
done
thank you
for
so
what you're
much.
doing.
I'm following your page too, and I love what you're doing. I'm so
Thank you.
glad we get to do this.
Yes, me too. I really think this is such an important topic. So I'm just glad to have this
Yes,
conversation. So just welcome here.
yes. Thank
Yes.
you.
So in order to kickstart the conversation, I want us to first address what are some misconceptions around women's sexual health, because I'm sure some people have their own beliefs about having particular conversations about this. So what are some misconceptions around women's sexual health?
Okay, so many a times I get to interact with young women because
Mm-hmm.
that's really my target. Those are my target audience,
Yeah.
right? So because of the level of experience and exposure is kind
Mm-hmm.
of low compared to mature women who already know these things.
Yes.
So many of the things I get a lot. Okay, so I think the most common ones are somebody comes up to me and say, okay, I haven't seen my period for the past 2 weeks or 1 week. Am I pregnant?
Mm-hmm.
So invariably, people just um, attach you not seeing your period automatically to you being pregnant. So I think that's one of those misconceptions. So I later tried to explain to them that you missing your period is it could be a result of so many factors, right? So it could be that you're on hormonal contraception and contraceptives, which
Mm-hmm.
could make you to miss your period, or it can move your period further um beyond the normal date when you're supposed to get it, when you're supposed to see it. So I think that's one of the misconceptions. No, missing your period doesn't automatically equate being pregnant. So I think that's one of them. It could be attributed to stress, low or high body weight, hormonal contraceptives, menopause, so many of those things. So that's one of them. And also people also believe that they can't, contract STDs or STIs because they use contraceptives.
Mm-hmm.
And I'm not talking about barriers like condoms and all. I'm talking about, emergency contraceptive pills and all of that. So people believe that, oh, because I use contraceptives, I cannot get STDs or STIs.
Mm-hmm.
So that's one myth I try to erase from their mind is barriers are the only form of contraception, right, that can prevent the transmission of STDs and STIs. Your drugs, your pills, your all the other methods do not, prevent the spread. As long as there's contact, there's sexual contact, vaginal contact, anal contact, or whatever sex the person is, involved in, there's possibility of transmission, right? So that's another myth I would love to debunk. you taking contraceptive pills doesn't prevent you from getting an STD, HIV, or all of that. So I think when people realize this, they will be more cautious, or sensitive to the kind of things they allow, the kind of methods that they use. And also, some people believe that you using after morning pills is the same as abortion, right? So people believe, oh, I don't want to use especially the religious ones, I don't want to use contraceptive pills because I'll be aborting my baby. You're not even pregnant yet, so it can't be abortion. Abortion is when the baby is being formed, and then you evacuate, you remove the child. So I would say that is one misconception. You taking contraceptive, you are preventing the child, or the fetus, I'm not supposed to say child, the fetus from being formed in the first place. So there's no child, it's just you preventing the sperm from, it could be you preventing the sperm from fertilizing the egg, or preventing the implantation of the fetus into your uterus. So there are various ways the contraceptive pills work. So it's not the same as abortion at all.
People
So
should not
I think that,
associate the pills with abortion. Okay.
yes, people tend to mistake contraceptive pills with abortion pills. So there are two different things, two different mechanisms
Thank
of
you. Thank you
action.
for covering
Yeah,
that. That was a lot of
yeah,
valuable info. So,
yes,
what are the
yes.
best contraception methods that women should use if they want to prevent pregnancy?
Okay, I'd say the best, right? The best is abstinence, because it is like, right now it's not really in vogue anymore, because when you say you're abstaining, people are like, are you serious? Like, in fact, people don't talk about it anymore because of the societal stigma that comes with it. So you just keep it to yourself, and you only talk about it when you're with intimate girls, trying to talk girl talk and all of that. So because right now, but that actually, abstinence is actually the most effective, 100%, because pregnancy or STI transmission can only occur when there's a meeting of the sperm and the egg cells. So when you're abstaining, and abstaining comes in different ways, right? So people abstain. People would say, okay, I'm abstaining, but I'm only doing oral sex. I'm not having vaginal sex. So there are different abstinence means different things to different people. But I'm talking about abstinence in the sense of no sexual activity, right? Because you can actually get STIs through oral sex, through anal sex, even if you're not having vaginal sex. So abstinence is actually the best. And I tell people, if you want to practice abstinence, you should make sure you're going into a relationship with somebody who shares the same ideology with you, because it's going to be a struggle if you're doing it with somebody who, you know, who doesn't agree with what you're doing. So you'll be like you're on your own, and it doesn't work most of the time, because at the end of the day, the person will definitely most of the time find their way, or the relationship will just break up. So it's better you communicate your ideologies before you get into that relationship or whatever. So, and the second is I'll talk about emergency contraceptive pills, which is what many young people opt for due to it's easily accessible, because you can walk into any pharmacy and say, I want to get Postinor too, and they'll dispense it to you. But for people who are in relationships, right, or who are married, then they intend to have unprotected sex for a long time, the best method for them is the long-acting reversible contraceptive method, which is the use of IUDs, intrauterine devices, right? So it's like a plastic that's inserted into the uterus of the lady, right? So it prevents the sperm cells from meeting the egg. So there are two types actually, the copper and the hormonal one. The copper one, sperm cells do not thrive with copper. Copper, copper, the element, right? So it doesn't thrive with copper. So when the sperm cells are going up the uterus and they come in contact with the IUD, they die off. So this is preferable for people who are in long-term relationships, or let's say marriage, who want to, prevent pregnancy for a long time. So this is what is more, is preferable. It's more recommended, because you don't expect somebody that's married to be taking Postinor every morning or every 2 days, because of the regularity of the sex. And also implants, such as hormonal implants, you put it under your skin. It's installed in the hospital. So, and these last for about 3 to 5 years. They last for longer. So you can when you start using it, it can stay for 3 years, 4 years, 5 years. You're not even bothered about getting pregnant or anything like that. So I think this is what people who are in relationships or marriages should opt for. Then there's the after morning pill, which is I already explained that, right? It is the most common emergency contraceptive. Probably you had, and it's usually for people who have unintended sex, because if you intentionally had sex, it is advisable that you use condoms, right? So, but some people have unintended sex. Probably you didn't prepare for it. You just stumbled on maybe your partner or whoever, and it happened, and you guys didn't plan for it, which is not really responsible for the age that we are in. But it happens, so you can opt for taking a contraceptive pill the next morning. Or some people just don't want to have, they want to have raw sex. So it's also advisable to use emergency contraceptive pills for unintended sex. So there's also the getting tested. I think this other practice is something that people don't really pay attention to. It's not the use of any contraceptive, it's just a behavior, which is getting tested regularly. So especially for people who have multiple partners, it's important that you go for regular testing. Just go to the hospital, have your HIV test, go for the HPV testing for ladies, the pap smear, go for your hepatitis testing. Just check, test regularly, especially if you are sexually active and you have multiple partners, or even if you don't have multiple partners, you've not been you're not even sure of your partner in the first place. There are people who are dating people who they know they are not faithful, right? So you need to get tested regularly. And in case you find out anything, you're having an infection, communicate it with your partner. This will help them also, start treating themselves and
That they
take care of
also can
themselves.
get tested.
Yes, properly. So I think other practices for safe sex, use of clean sex toys. People really don't talk about this, because nobody's expecting you to be having, sex toys when you're talking about sex. They feel, oh, that's your own private matter. Nobody should talk about it. But the truth is that many people get infections from sex toys, right? So you're using a sex toy regularly and you're not cleaning it properly. You're not, taking care of it. It's not in it, and you're putting it inside your body. So it's one method, it's one way to get infection, and it's one way to get infections into your body system. So it's important that you take care of whatever it is you're inserting into your body. So I think those are the best practices. Yeah.
You said some great points that women should regularly get, testing, just to make sure that everything is okay. And I also
Yeah.
want to go back to your points on talking about the fact that you can actually get infections through sex toys. Can you talk about some of the signs that somebody might have an infection? What should they be aware of?
Okay, so it depends on the individual and the nature of the infection. I did a write-up on vaginal candidiasis a while ago. That one, it's a fungal infection caused by Candida albicans. So that's quite different from a bacterial infection. So depending on the nature of the infecting microorganism, that will determine the nature of your symptoms as an individual. So, but there are several symptoms that are general. Burning sensations while urinating, burning sensations while having sex, smelling, fishy smelling discharge, weird colored discharge, green, red, brown discharge they are not normal. There's sores or bumps in your genitals, itchy genitals, blisters, unusual vaginal discharge, and I think that's those are the major things. Redness, swelling. So for vaginal candidiasis, you see you see discharges that look like, should I say, clumps of, white clumps. They're just big white clumps here. That's for vaginal candidiasis, and that is not entirely sexually transmitted. Young people who are not even sexually active do get vaginal candidiasis, so it's not categorically an STD, but it can occur in a person. So those are the basic signs and symptoms of sexually transmitted.
Yes, thank
Yeah.
you. Yes. So I
Yeah.
also want us to go back to contraception method, and for people who
Yeah.
they've had children already and they've decided that maybe the woman doesn't want to have any more children. So what would you advise her if she says that she doesn't want to have any children? What would be the best method for her?
Okay. If you don't want to have children again, there are two major methods that are recommended. We have the permanent contraception method, right? So this one is permanent and irreversible. It's called there are two of them, vasectomy and tubal ligation or tubal sterilization. Vasectomy is simply is a minor surgery to block the sperm from reaching the semen, right? So the person is going to ejaculate normally, but the ejaculation contains no sperm cells. So the sperm cells are absorbed by the body instead. So it's the man that goes through that, not the lady. The man goes through vasectomy, right? So they just make sure that there's no more semen coming to the ejaculatory fluid. So when the person ejaculates, the person is going to have sex normally. It's going to do everything normally. But when the person ejaculates, the ejaculatory fluid will contain no sperm cell at all. So it's incapable of getting anybody pregnant. So that is a permanent and it is irreversible. And also there's a tubal ligation. This one is tying, cutting, or blocking the fallopian tubes, to permanently prevent pregnancy. So there'll be no release of ovaries anymore. There'll be no sperm cells can't get to the ovaries, to the eggs rather, to the egg cells. So there'll be no possibility of fertilization, right? So the lady goes through tubal ligation, not the man. So it depends on what the family decides. So if you and your partner say, okay, we don't want to ever give birth again, you have to take note that there are two methods you can opt for. Permanent contraception method, which is what I'm just explaining, that consists of the vasectomy and the tubal ligation. Then there's the reversible, which is what I explained earlier, the long and reversible contraceptive method, right? That contains the IUD, which is what I explained earlier, the intrauterine device that's inserted into your uterus as a woman. It prevents the sperm cells from surviving and from even getting to your egg cells, and prevents fertilization. So this IUD is inserted into the woman's uterus. There's also the hormonal patches, that are put under your arms as a lady. So you can see that basically contraception, it falls, the methodologies makes it fall more on the woman. So most of the methods, the woman. So this has brought a kind of irresponsibility on the part of the men. So they feel, oh, why didn't you take care of yourself? Why didn't you do this? So when you see a girl getting pregnant, you find the guy asking questions. Like, the guys are not really, enlightened to know that contraception is a responsibility of both parties. So you don't just say, oh, why didn't you take the drug? Why didn't you use a protector? Why didn't you use condom? Why didn't you, So we need to educate, men also, that contraception is a responsibility of both parties.
Yeah.
And it also helps because I've interacted with a lot of ladies who said, oh, the reason why the reason why my boyfriend and I have unprotected sex is because he doesn't like using contraceptives. He doesn't like using condom. He says he doesn't enjoy it, right? And the lady ends up, going through hell and back because of his decision. So he doesn't want to use condoms because he doesn't feel it, in quotes. And then she agrees because she wants to, please him and all of that. And after everything, she's the one getting the infections. She's the one going to treat herself in the hospital. She's the one, going to look for emergency contraception and
Yeah.
contraceptives. So I think that's where I feel we need to educate men more, that it is a responsibility of both parties.
Yeah.
Contraception is not just,
the woman.
yeah,
So
exactly. You shouldn't just leave
they
it to
have
the
to know that
woman.
they also be mindful of what they are
Yeah,
doing.
exactly.
Yeah.
Exactly.
Yes.
Yeah.
That's
So,
wonderful. Thank you. I also want
okay, I already explained the second one. So continue.
Okay, awesome. Now, for
Yeah.
women who want to have children but they are having issues, what could be the problem? Is it due to the contraception, or what? How would you advise them to proceed if they are
Okay.
having issues having children?
It depends on the stage of their marriage. If you're just
Okay.
married, right? If you're just married and you can't have children, you shouldn't be bothered. I mean, you have time, right? So it's only a case when you've stayed for a year of unprotected and carefully timed sex. Do you understand? Some ladies don't understand that there's a timing for sex that can, get you pregnant. You have your ovulatory timing and all of that. So if you've had carefully timed sex for an unprotected sex for over a year and you don't get pregnant, that is when you should start getting worried, right? So and then you go to your gynecologist. Now it could be, there are so many reasons why somebody can, not be able, can have such issues, infertility issues. So it's not something you just sit down and go to Google and say, okay, why am I? You need to go to a gynecologist, and you need to, you and your husband, because many a times it could be the man's fault and you are the one running up and down and there's nothing wrong with you. So it could be the man who has all the issues, and then he's in the house saying you have to go to the hospital, something is wrong with you, and nothing is wrong with you at the end of the day. You could have low sperm count. It could be it could be your hormonal imbalances. So there's so many factors, but the both of you need to go to the gynecologist, to further lay your complaints and then seek solution. So that's what I recommend.
Thank you so much for mentioning that, because I think so many women blame themselves if they feel like they can't have children, and so many men are quick to say that it is the woman. But I'm glad you said that sometimes the men, due to low sperm count,
very true,
affects that.
very true. I saw a post on Facebook today, and it said a man endured his childless wife after 21 years and she gave birth to twins. And I was like, and people were saying, as in, people were commenting and happy on that. And I was like, why would you say a woman, a childless wife? Do you know the cost? People don't even understand. Nigerians just believe, once a couple don't have a child, the woman is the problem. But we have men, countless issues of, low sperm count, so many, cases of all of that. But they don't want to know. They just know, it's the woman. She's the one that is barren. She's childless. And I think so we need society to start listening and learning to know that, okay, there are so many factors. You don't always have to blame the woman. She might not even have any issue at the end of the day. So I think I just needed to point that out
That's
for people
a great
to
point.
know. Yeah.
Especially partners, they also need to make sure that they're having these conversations with their husbands to make sure that, okay,
exactly,
if something is wrong, we both need to go and get a checkup.
Yes.
Thank you. Thank you so much. I also want you to tell us about the amazing work you're doing, because I feel like we all need to be more aware of it, and how can we support your initiative?
All right. Okay. So I'm this executive director of TMI Africa. We work for, like I said earlier, our target audience are young people between the ages of 15 to 24. That's what the World Health Organization categorizes as youth, right? So we believe that there's been a lot of cases. Over 610,000 young girls get pregnant every year in Nigeria, unintended and unwanted. That's where it's bad. If you want the pregnancy, there's no problem. But when it's unintended and unwanted, there's a big problem, because now they start seeking solutions. Nigeria is not the kind of country where you get pregnant and you go to your parents with your chest and say, I'm pregnant. How? They will first when they are done with you, like, you'll be regretting why you started in the first place. So and I'm still in school. I'm in my 5th year in the university, and so I work with a lot of young girls in my university, and I encountered a girl in my 300 level. That's where I started, this whole thing. She was pregnant at 100 level. So, and she was staying in my room. I was wondering why she came with her pregnancy to school. I couldn't understand. Like, even if you're pregnant, like, she was like 6 months pregnant. And she wasn't hiding at all. She was everywhere. So I was so curious, what is going on? So I went to ask her, and she happened to be an open person. So she told me everything, that what her parents did to her in the house. And they forced her to come back to school, because they are this kind of educated, stern people, and they said, you must go back to school whether you are pregnant or not. Nobody sent you. So with that, with the pain and the rejection in the house, she wanted to face the world with her chest. She was not even shy anymore. And I realized that so many young people were going through that same thing, but they're not coming out to tell you. Some of them will opt for an abortion in an unsafe clinic, and they're still yet to bear the consequences of what they've done, because right now it seems as if, okay, the abortion was successful, everything is over, but it's waiting for them, some of them, later on. So I began to understand that society don't really talk about these things. Nobody talks about especially in the university. Everybody just believes that, oh, once you're in university, you have sense, so you shouldn't get pregnant and all of that. But it's not like that. People are getting pregnant every day, and they are looking for unsafe means of aborting, and they are aborting the babies, the fetus rather. So I said, okay, why not you teach people how to prevent it, instead of having them go through all of this. These things are simple, right? Why not you learn how to prevent it? So that is how we started the initiative to educate people through online materials, campaigns, awareness programs, and all of that. So we organize outreaches for young people, teach them all they need to know, answer their burning questions, connect them with medical counselors to see them through. Even if you're pregnant, you can still come to us. It's not the end of the world. There are so many options available. If you can't take care of, I think the most heartbreaking news I heard during this pandemic was the young girl who murdered her child. Right? She just got admitted into a university. I don't know if you heard that story. And she just got admitted into the university, right, to study law.
Wow.
And before the school resumed, she found out she was pregnant, and then that was the end of her education. Her parents weren't well to do, so she didn't have financial support, so she had to stay back. She was taking care of that child, and she in fact, that can even give you mental issues. Just imagine knowing that your future is being sacrificed just because you made a mistake. You keep blaming yourself every day. But the guy he doesn't, bear any responsibility. He's living his life. So I felt really bad. And then I think one of those days she got frustrated and drowned her child in a bucket of water. And that's how she was arrested. And the news was everywhere, and people were insulting her and insulting. I said, why are you insulting her? This girl, you don't understand the trauma she must have gone through. We don't have social support in Nigeria. We don't have, the support system to help, young single mothers to go through the process. So it's really an issue, because nobody has to lose their education because you're pregnant. You can opt to adopt, put the child up for
because
adoption.
there are people who are looking to have children who can't
exactly.
They want to raise a child.
But not everybody is aware. Nigeria, many people are not aware. So they just do things, oh, I didn't see money to take care of my child, and they will end their education, end their lives. And how can we achieve gender equality if our girls are getting pregnant and leaving school? Who's going to go to the school? And you're putting the men who put them pregnant, who made them pregnant, continue their lives like nothing even happened. So I think it's something everybody should be
Yeah.
conscious about, and
Yeah.
educate young people
Exactly.
about, because
Yes. I'm so
yeah,
glad you brought that up because I feel like the best way to do this, like you said, is education. And I know you said you're targeting
yeah,
audience 15, but I even think that just from that primary school level, honestly, I feel
yeah,
like from that
yes,
very primary school level, there needs to be that education and understanding of the
exactly.
implications, consequences, what people can do. Because what you
Yeah,
told me,
that's part.
yeah,
Yeah, that's part of our advocacy, actually.
yeah,
We are trying to implement comprehensive sexuality education into the
yeah,
curriculum of schools. So
yeah,
even it's going to be age appropriate. So at age 4, you know what you're teaching them. You're not going to be so deep into
exactly,
everything. At
exactly.
age 6, you know what you're teaching them. At age 10. So when it's age appropriate and it's incorporated into the curriculum, I think it's going to be very effective at the end of the day.
Mm,
Even in cases of sexual violence, rape, and
yeah,
all of that,
exactly.
many young girls are not, enlightened. So they
That is,
don't know anything about consent. They don't know. These are things we should teach them at a young age. Some girls don't know how to be assertive and say no, and outrightly refuse a situation and walk out. So they are just shy, and they don't know what to do.
yeah.
You
And there are
when
people
you
who
make
take
when a
advantage
man is,
of that. They'll take advantage.
yeah,
You know, you are vulnerable and
yes,
you are
people
not
make
it. Exactly.
exactly. So if you realize, if you read most of the stories going on during, there was a period that people were calling out their abusers on Twitter, and the
Hmm.
guys were confused, and they were saying it was not rape, it was not rape, it was
Hmm.
consensual. And when the girl we explained the situation, it to her it's rape, but she was not, probably she didn't outrightly refuse,
Yeah.
she wasn't assertive enough, so the guy will now think it's consent. So I think
Yeah.
we need to teach ladies a lot of things, and comprehensive sexuality education being
Exactly.
incorporated into the curriculum would
Yes.
really go a
Yes.
long way to
Yes.
curb many of these
Yeah.
issues. Yeah.
Really, it does. And I actually want to bring up the issue of sexual education. I think that sometimes, I know when I was serving for NCA, I remember we covered an event where parents were protesting against sexual education. So I feel like there's this
Wow.
whole issue in Nigeria where people feel like if there's sexual education, you're advocating for people to have more sex. But it's not advocating for young or married people to have sex. It's just for them to be
Yeah.
more aware and knowledgeable about this. So I think that's the whole
Okay.
myth around sexual education, that if you are putting out the information there, you're just enticing people to be reckless and do whatever. But that is not really the case.
Okay.
So I think more parents also need
Exactly.
to get on board with having it in the curriculum also. So I hope that that is also part of what your group will do. Try to educate
Yeah.
parents that they will allow
Exactly.
it to be in the curriculum, in the system.
Yeah, yeah, it should.
Yeah.
We actually, there's a study actually about, the results. Nigeria, we really don't have data, right?
Hmm.
But if we,
Yeah.
I read a lot of, publications by the UNFPA and all of that.
Yeah.
So there was a study to show the difference in results between comprehensive sexuality education and abstinence only education, right? So they taught a certain population abstinence only. So they didn't
Okay.
teach them anything about consequences of sex, how to prevent, pregnancy, how to prevent STI. They didn't teach them any of that. They just say, do not have sex, do not have sex, do not have sex. And that was like the message.
Hmm.
So, and at the end of the day, it came out that those people who were taught just abstinence only education wanted to explore, okay, this sex
Hmm.
they are saying we should not have. What if I
Exactly.
try it? And they found out that, okay, I did it and nothing happened. So what they said is a lie. And they
Hmm.
continued without the information of protecting themselves and
Yeah.
all of that. So they found out that they had more unwanted pregnancies among that population. They
Yeah.
had more sexually cases of sexually transmitted infection, as opposed to the people who were giving comprehensive sexuality education, taught everything, and
Ex-
those ones had reduced cases because
yeah.
they were able to make informed decisions because they
Exactly.
already knew all these things. So
Exactly.
I feel our social system, we had a lot of work to do. We have
We
a
really
lot of
do.
education.
We really do.
Yeah. So yeah.
Because
So
in
that's
Nigerian
it.
society, we already know that there are so many challenges and difficulties. You don't need more people bringing in children that they can't take care of and that's going to cause them problems.
Exactly.
We are already living in
Exactly.
poverty, so people need to be better educated about these things.
True. True.
Yes. So thank you so
Yeah.
much for the amazing work you are doing. I'm going to continue following
Yeah.
you, support you anywhere I can. I'm glad that we
Yeah.
had
Thank
this
you.
conversation, and let's just
Me
keep
too.
having the conversations. Whether people are comfortable or not, it needs to be talked about. Yes.
Yes, it
Thank you
is.
so much,
Thank you.
and well done to
Thanks
you.
for having me. I really appreciate.
Awesome. Well done.
Bye.
Bye.
Yeah.
I'll see you people in the next episode of Girl Talk with AC. Bye.
All right. Take care.